careful studies evaluating COVID-19 vaccines in real-world settings have shown that COVID-19 vaccines are very effective. Among individuals who are fully vaccinated, these vaccines have been shown to significantly reduce the risks of getting and transmitting COVID-19, and more importantly, to dramatically decrease the risks of severe illness and death. On this week's Health Talk, we'll discuss how COVID-19 vaccines offer us hope in overcoming this pandemic, and our guest is an infectious disease specialist, Dr. Nabeela Khan from Norwalk Hospital. Stay tuned, Health Talk is up next. Hello, I'm Dr. Eric Mazer. On this week's Health Talk, we are discussing how COVID-19 vaccines are helping us overcome the pandemic. Our guest is infectious disease specialist, Dr. Nabeela Khan from Norwalk Hospital. Nabeela, welcome back to Health Talk. It's so good to have you here.
Thanks for having me.
You have the luck and the misfortune of being an expert in the topic of the day, the week, and the year, COVID-19. You've been through the COVID-19, the worst of the COVID-19 pandemic. And today we want to talk about the vaccines. There's so much information and misinformation out there about the vaccines. What do they do and what don't they do? If you could help us with some of that.
So we know,
in a positive sense, I'm talking about.
So we know that COVID-19 vaccines are fairly safe and they are highly effective. Hundreds of millions of doses have been administered now. Before they were available for the general public, they went through clinical trials. Scientists have studied the mRNA vaccines for many years prior to the development of the COVID-19 vaccines. And that knowledge helped tremendously in this effort for the COVID-19 vaccines. And that also helped speed up the process. But all three of the COVID-19 vaccines that are approved to be used in the United States have gone through clinical trials. They have completed all three phases and have been reviewed by the FDA and have been determined to be safe and effective. And that's why they've received emergency use authorization.
So when we say effective, we know it doesn't absolutely prevent you ever from getting or transmitting COVID-19. Can you give us some idea about what we mean by safe and effective and how that maybe compares to other vaccines that we're used to, like measles or mumps or flu?
So we know that COVID-19 vaccines can prevent in certain scenarios of getting the infection. But if you were to have the infection, because they're not 100% effective, it does attenuate the virus so that you don't develop as many symptoms as you might have if you were unvaccinated. And most importantly, it prevents people from getting hospitalized and even dying from COVID-19. What we're seeing now is that most of the COVID-19 cases are in the unvaccinated population, and clinical trials have shown that if you're fully vaccinated, then you are 8 times less likely to get the infection and 25 times less likely to end up in the hospital and dying versus if you were unvaccinated. So, and also studies have shown that the Pfizer BioNTech vaccine is 95% effective against developing symptomatic infection versus Mrna, which is 94% effective.
Yeah.
So that's
splitting hairs then between the two vaccines.
Yes, yeah.
And how about I want to go back and talk a little bit about the mRNA technology, because I think a lot of people don't realize this is a brand new kind of vaccine for humans. But when we look at both these vaccines, what are there are some side effects. What are the side effects to them? And how much does someone have to worry about that?
So most of the side effects that have been reported, not only in the clinical trials and also from people receiving the vaccine, is it can cause people to have fever. Some people can have body aches. Obviously, the site of the injection, your arm will hurt. That is what has mostly been reported in the literature.
And I will report that as a human being.
Right.
In that first dose, no side effects. Second dose, mild body aches, maybe very low-grade fever. I did get the booster at half dose for Mrna and spent the next 24 hours in bed with a fever of about 101 and a lot of body aches. But they go away. And the point is that I'd much rather be under the weather for 12 or 18 hours than sitting in the ICU or, God forbid, dying of a disease that's preventable.
Correct, that is true, yes. And when you do have side effects, it's sort of your immune system reacting to the vaccine itself. It's not the live virus that's given, it's just the genetic material, it's just the code actually that then allows your body to make antibodies so that if you do get exposed, you already know that this is something foreign and that your body needs to get rid of it.
Well, maybe that's the segue into talking about the mRNA vaccine, because a lot of people hear that term now. I guess the COVID and the Pfizer are the two mRNA, and J&J is the old-fashioned vaccine. But just, we were talking before the show, most vaccines that actually all vaccines that we've gotten up until this point in history have been either the virus itself that has been weakened in the laboratory, but it's the whole virus, or a piece of the virus that's been grown in the laboratory, or a dead virus that's been grown in the laboratory. But it's always been part of a virus. Maybe you could talk about how the mRNA vaccine is so different and in many ways so much more flexible for future vaccines. I think that, you know, we're really focusing on COVID, but this revolution, in my mind, of an mRNA vaccine changes the development of vaccines forever.
Correct. So the mRNA technology is not particularly new. I think what is new is that for the first time we were able to use it towards a particular disease. So that's the new part. Scientists have been working on mRNA technology for decades now, and they've looked at other diseases such as the Zika virus. They've also looked at Ebola virus. But this time they were effectively able to come up with the sequence that helped with this particular infection. So like you said, it's just the genetic code that's being given to our body.
For a piece of the virus.
For the piece of the virus. It's not the virus itself. And then it allows our own cells to make the protein to help us fight off the infection.
So again, what we're doing is actually, we get the injection, then our body actually makes a large volume of a piece of the virus. We're making it.
Correct.
And then our own immune system reacts against that protein that we've made, and we're immunized.
Correct.
Again, but the nice thing about that, just for folks at home, is you can design any sequence in the RNA you want. So if there's a variant out there, it's pretty easy to modify that code for a variant, or almost for any virus now, we should be able to pretty easily come up with almost an infinite number of vaccines to see how efficacious they are. So this is a real new technology.
That's true, yes. And they are looking at other viruses to help. And also, they're also looking at cancer to see if where this technology can be helpful in that regard.
Because it really allows us to make very specific things that would be hard to manufacture in the laboratory. Let me ask you a dumb question, and I'm sure people at home don't think about this. When you get the mRNA vaccine, I got it in my left shoulder, the mRNA goes in, is it the muscle cells that make the antigen, or does the mRNA get distributed more widely, and is it other cells that make the antigen? Because we know our immune cells are our lymphocytes that react against it, but where actually is the antigen made? Do you know?
So it is usually in our muscle cells, and so once it gets injected, our muscle cells do take it up, and then the coat around the code that's being given is taken off by our own cells, which then exposes that genetic code, and then that allows our own cells to make the protein that's needed.
And that's why your arm gets so sore afterwards.
Yes.
It's not sore at the beginning because you don't have that immunologic reaction going there.
Correct.
My wife actually got a baseball-sized swelling at the size of her injection. So those happen. Again, I think people, let me ask you some other question that came up. Should people take anti-inflammatories around the time of vaccine? I don't think anybody has an absolute answer to that, but what's recommended? The reason for that is anti-inflammatories can dampen down the immune system, and you don't want your immune system dampened down after a vaccination. What are you recommending to people?
So currently, what the CDC is also recommending is, along with the Infectious Disease Society of America, is that after you've gotten the vaccine, if you do develop the symptoms, if you're getting body aches, muscle aches, fever, or chills, at that point you can definitely take an anti-inflammatory to help with your symptoms. They're not recommending that people pre-medicate before getting the vaccine.
That's very, very, very interesting.
Mm-hmm.
So how about the waning of immunity? Can you talk a little bit about that, and also maybe say something about antibodies versus T-cell immunity? I think people are finally beginning to understand that there's more than just antibodies when we're talking about immunity.
Right. So there's a lot that we don't know in regards to how long does this immunity last us. But so far, the clinical trials have shown that at least in speaking about the 65 and above population, studies showed that our immunity did wane 6 months after the initial series, which is why the recommendation came out.
Was that because they showed that antibody levels fell, or did they show an increased frequency of severe disease after the 6 months?
So it was the antibody levels had decreased and people were ending up with severe disease, which is why the recommendation came out that if you're 65 and above and have had your initial series 6 months prior, that you should consider getting the booster to prevent you from developing severe illness and getting hospitalized. Overall, the vaccines are still considered to be effective. What impact does this have in the 64 and lower population? We're still learning. What role does T-cell immunity play in all of this? We're also still learning about that. So hopefully more to come in regards to our full immunity.
Could you take just a couple minutes and explain to people what antibodies are?
So antibodies are...
Because we talk about them all the time now.
Right, yeah. So antibodies are generated by our own immune system, and they're basically, they allow us to recognize, it's just our memory cells, essentially, that allow us to recognize that something is not part of our own body. So it really plays a significant role when we're exposed to bacteria that shouldn't be there, or other infections caused by viruses. It's just our memory cells that recognize, hey, I don't think this is supposed to be here. That allows us to then...
And those foreign invaders express or have on their surface protein structures that are unique to those invaders.
Correct.
And our bodies, it's really amazing that we can do this, can manufacture neutralizing proteins almost like a glove fitting over a hand or a lock fitting over a key that just neutralizes that foreign structure. And so that's why we can even give antibodies. If you have had COVID, I can take your antibodies and give them to me. It's sort of an amazing thing.
Right, and in certain treatment cases, we do give synthetic antibodies, like the monoclonal antibody that Regeneron put out to help people fight off, to just aid their immune system.
And we're using monoclonal antibodies in so many, that's a whole other show to talk about, but it's a technology that truly is amazing. Again, sort of designer proteins that work in so many ways. We're giving them in cancer therapy all the time now.
Yes.
So where do you see the future of the vaccine? Are
So
we all going to be getting a booster once a year? Are we going to be going through a bunch of variants and getting a little different booster?
So I think the future will tell. I think as we get more and more data, currently the recommendation is for people who are 65 and above who've gotten their initial series 6 months prior should get a booster. And also, if you're between the ages of 18 to 64 and you have certain underlying medical conditions, for example, if you have chronic lung disease or if you have respiratory disease, then you should consider getting a booster. People can always go to the CDC's website to actually see what the qualifying medical conditions are that will allow them to get a booster. And then also if you're...
And really those are people that may not produce antibodies as robustly.
Correct.
So they may need a little bit more, a kick in the pants, if you will, to produce enough antibody to be immune.
Right, yeah. And then as far as the general population in terms of getting a booster, I think as more and more data comes in, we'll see.
And that's one of the problems right now is we're doing all this in real time, which is uncomfortable, but we have to live with that. And unfortunately, that is all the time we have for now. I want to thank Dr. Khan for joining us today on the set, and thank you for watching. You can share your comments and questions with us by emailing us at healthtalk@newvancehealth.org. We'd love to hear from you. We'll see you next time on Health Talk, and if you're an old man like me or an old woman, get your booster.
145 over 92. 180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself, I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. Coming back. Ask your doctor, check your blood pressure.
The FDA has recently authorized COVID-19 vaccine boosters for certain individuals, and the CDC has also endorsed and provided guidelines for these boosters. On this week's Health Talk, we'll discuss what you need to know about boosters with infectious disease specialist Dr. Nabeela Khan. She's from Norwalk Hospital. Stay tuned for an important Health Talk. We're up next. Hello, I'm Dr. Eric Mazer. On this week's Health Talk, we'll discuss how COVID-19 vaccine boosters, are they appropriate for you or a member of your family? Our guest is infectious disease specialist, Dr. Nabeela Khan from Norwalk Hospital. Welcome to Health Talk, Nabeela. It's so great to have you here, since I'm going to ask the same questions that everybody at home is asking, and that is, what about boosters? I guess they've been approved and recommended now for this by the CDC, what, for over 65?
So, right, to figure out if you're eligible for the booster, there are certain populations that should get a booster 6 months after completing the initial series. And it really depends on which vaccine you had for your primary vaccine series. So, for example, for those individuals who received the mRNA vaccine, those are the Pfizer, BioNTech, and Mrna Vaccine. If they are above the age of 65, they should consider getting a booster, or if they are younger and have certain medical conditions, definitely should consider getting a booster. As it pertains to the Janssen vaccine, the CDC currently recommends that if you completed your initial series 2 months prior, you should definitely consider getting a booster regardless of your age, essentially. So for that population, it is recommended.
Now, I've also heard mix and match is okay. Explain that to me.
So the preference right now is if you completed your initial series with the mRNA vaccine, that you should get a booster with that same mRNA vaccine.
So if you've had Moderna, it's okay to get Moderna or Pfizer.
Correct. Right. But there is data now that shows that if you mix and match, and this mostly pertains to those individuals who received the Janssen vaccine, if you want to get a booster with the mRNA vaccine, you can. So the CDC is allowing to do that based on individual preference.
Now, you know, we were in January, wasn't that long ago, we were pushing everybody out there to get their first vaccine, and here we're, what, 8-10 months later, and now we're talking about boosters. Why do we need boosters? How do we know we need boosters? And are they going to work?
So, so far the clinical trials have shown that after a certain amount of time, your immunity as it pertains to severe disease wanes. And that's why the recommendation had come out that that 6 months after, you should get a booster to sort of give yourself an extra boost to help fight off this infection. And this mostly pertains to developing severe illness and hospitalization.
Does this mean we're going to be getting boosters every 6 months?
I think time will tell that. We
Because
don't have enough information in regards to that recommendation.
Because it's really, we're really, and I think people don't really understand this at home, we are doing this in real time. So we can't look at 5 years effect of a booster or of even a vaccine. We can't look 5 years down the road. We don't have that experience. So we're trying to develop recommendations as time goes on, and they're going to become better and better because we'll have more data to look at. I have heard and maybe you could say a few words to this, that maybe the interval, we base the intervals of the initial vaccines based upon the way the studies were set up. So I guess Pfizer gave it 3 weeks apart, and so the 2 shots were given 3 weeks. Moderna was 4 weeks apart, got it 4 weeks apart. But I've heard that actually that might have been too early, and that later second shots might have given us a much bigger boost in immunity, and I want you to say yes or no, explain. And so maybe these boosters, I'm asking you, maybe they're going to give us a boost in immunity which won't require another booster, or require one every 2 years or 5 years. Any thoughts on that? Because I have heard, again, that maybe we spaced the initial 2 shots, jabs, too close together.
That's quite possible. Again, we don't have enough information, and we're not measuring T-cell immunity, and what role does that play in protecting us from this disease. So the clinical trials looked at the antibody levels, and they measured it at certain time points, and that's why 6 months later, when they saw that the level came down, they made that particular recommendation. But we still also don't know what is that magic threshold of antibody level that we need in order to give us enough protection. So as time moves forward—
I heard the correlation is not of antibody level and susceptibility to severe disease was not that great.
Right, yes. So as I think time moves forward and we get more and more data, because the CDC and the FDA is actively monitoring through various safety monitoring systems in regards to how effective are these vaccines in the real world, that recommendation will come out.
Why does, I've actually read a little bit about this, that our public health infrastructure, data collection process was not really prepared for this kind of a problem. And we're getting a lot of information from Israel, where they have a better database. What's missing in our country, and what should we do to prepare for the next time?
I think a lot of resources have gone now with the current pandemic, but there's always a lag in regards to how you're collecting the data and analyzing it and then being able to make recommendations. So I think that the challenge has been that we're sort of learning about this new disease as we're trying to treat people and protect them.
And acquire the data about how to treat them.
Right. So I think that has been the challenge. But I think our public health system in this country has done a tremendous job in, making the public aware of the situation and giving us the necessary tools. Obviously, there are certain areas that everybody can work on, but overall, I think they have done a tremendous job.
Well, I do remember with my vaccine, which I got a little bit early because I'm a physician, I got sent something from a central vaccination, I think it may have been from the CDC, asking me how I felt today, how I feel tomorrow, which was voluntary.
Yes.
But I would urge anybody who can participate in those things to participate, because that's how we get the information that we need.
And that is the unique part of this pandemic, and that is the real monitoring of systems, which we didn't have for other diseases before, that the CDC is actively acquiring data from those who have received the vaccine. How do you feel today? Are you having fevers? And that is helping tremendously in continuing to learn about these vaccines.
And I think people don't understand. They think science is an absolute, and you're moving towards the absolute truth all the time, but it can jiggle along the way. And this is not bad science, and it's not unnecessary uncertainty. It's the way we develop information.
That is correct. Yes. Yeah.
Because I think there's a lot of the politicization. I think it's very unfortunate that this disease and the therapies have been so politicized.
But I think the science has been clear in regards to what this disease is, what do we need to do in order to protect ourselves, and as it pertains to public health measures, I think even though a majority of the population now is fully vaccinated, but I think in certain scenarios it's still as important to keep your mask on, keep your distance, especially if you're going to be in an area where there's a high risk of transmission.
And I should point out, we're in a hospital, we wear masks,
yes,
all offset here, and we are 6 feet apart.
That is that is correct, yeah. And I'm fully vaccinated.
And I'm fully vaccinated.
Yes.
And I've gotten my booster for folks at home.
Right, yeah.
Because, I don't want to die at this point.
Correct, yeah.
We don't really know whether are we seeing the same short-term side effects from boosters? Are we seeing some of the myocarditis? Well, we're not doing young men, I guess. Are we seeing myocarditis or thromboembolic disease, blood clots now with these later vaccines yet?
So with the boosters, I think the data is not available yet. The clinical trials did show that people did have some reaction after getting the booster, and they listed them as minor side effects such as fever, chills, similar to what happened after the second dose. The risk of myocarditis is present. However, if you weigh it against the benefit of getting the booster, protecting yourself, it is extremely lower than the overall benefit.
And the CDC recommendation for children, is it 5 and up or 6 and up, is relatively fresh. Do you want to say a few words about that?
So yes,
because those kids are at lower risk for hospitalization, they're at much lower risk for death, and we don't have a broad experience with side effect profile in the really young kids yet.
So I think with the Delta variant, we did see increased number of cases in the pediatric population, and the kids were getting hospitalized, and some of the kids actually died from this disease.
Were those kids otherwise immunologically normal with no significant comorbidities?
I think that was the case, yes. And a couple of weeks ago, I think the FDA granted Pfizer the emergency use authorization to be used in kids 5 to 11 years of age. And that's because the clinical trial data showed that it was fairly safe, it was highly effective, and not only did it protect the kids, but also the other vulnerable population. I know kids younger than 5 years of age can't get the vaccine yet, but they can get the disease, so we still need to do our part in protecting that population, and also the highly immunocompromised population. Yes, they've gotten the vaccine and the booster, but because of the weakened immune system, they still remain at risk for acquiring the infection.
Yeah, and maybe we've got 90 seconds left, but there's a lot of publicity about certain people who have died despite vaccination, and while I think that can happen normally immunologically, there are certain, and I'll say this as an oncologist and a hematologist, there are certain diseases where you're not going to respond much or at all to a vaccination. It's always worth giving it, but it's no surprise to me that if you have multiple myeloma or lymphoma, or you're getting aggressive therapy for leukemia, that you are not able to respond to a vaccine.
That is very true, and that not only applies to COVID-19, but it also applies to other viruses and other bacterial infections as well. But overall, these vaccines are highly safe and effective, so it's still a very good idea to get vaccinated.
Now we're down to less than a minute. We've also heard about new drugs coming that are very effective in treating COVID in its early stage and preventing hospitalization. I know we don't have a lot of data on them, but you just want to say how they may change our approach a little bit, or what you think they'll have an impact on the pandemic?
I think they will have a tremendous impact on the pandemic, and it's looking very bright. I think the FDA is looking at the data, and hopefully will make a recommendation in the next couple of months. But it will be similar to when people get the flu, and if they take a medicine like Tamiflu, I think it will be the same with COVID-19. So if I was to get exposed to somebody, or if I had mild symptoms of the disease, I can take a pill and sort of shorten my recovery time period. So
it seems to me, and I think we discussed this ahead of time, but between the vaccines, the booster, extending the vaccines into the younger population, and these new antiviral drugs, maybe the pandemic is not that not much continuing in the future.
I'm very hopeful.
Maybe there's light at the end of the tunnel.
Yes.
That's what I'm trying to say. And that's a nice way to end this. I think that really, compared to a year ago, there is so much light at the end of the tunnel. And that's all we have time for today. I really want to thank Dr. Nabeela Khan for joining us, and thank you for watching. Please share your comments and questions with us by emailing us at healthtalk@newvancehealth.org. We want to hear from you. See you next time on Health Talk. Bye-bye.